You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile could make a big difference. Today's topic, 6-month smiles, adult orthodontics becoming very popular. With us, we have an expert on the topic, Dr. Joe Capista. Dr. Capista, welcome to the program.
Thanks for having me on, Randy. Appreciate being here.
So before we get into today's topic, tell me a little bit about your practice, who's your typical patient, and what are the different procedures you do?
Well, we have a group practice. There's 4 dentists in our practice. I happen to be the founder and senior partner in the group. The name of our practice is Williamsburg Dental, and you would think that that would be in Virginia, obviously for Williamsburg, Virginia, but we're in a suburb of Philadelphia, about 15 miles outside of the city, in a town called Broomall. And we have a beautiful 6,000 square foot state-of-the-art building on a street named Williamsburg Drive and 320. So that's the name, how it came about.
And you're big on experience. I mean, you say this is not your, I mean, we've talked in the green room, that you're big on customer service, creating this unique experience.
Well, it's funny because when we have patients come to our office, we don't view them as patients. They're guests in our home. Okay. And think about it. Going to the dentist, who wants to go to the dentist?
Nobody wants to go
to the dentist. Nobody wants to go to the dentist. Can you think of a worse? I don't want to go to the dentist. I have tons of dental work done. So why wouldn't you want to make it pleasurable? Okay. I mean, you can't make the dental work pleasurable, but you can make the experience pleasurable. And that's what I talk about.
Do you still hear it, by the way? People say, no offense, doctor?
Every day.
What do they say? How do they say it?
I hate coming here. I don't want to do this, but I love your soft presence. Everybody's so nice. So you can't make the procedure good, but you can make the one of the things, you know, our goal is to have value and experience. So, you know, obviously dentistry is expensive, so you don't want to just pay for something. And our goal is to provide good dentistry and good customer service. We benchmark ourselves against the tops. 4 Seasons, Ritz-Carlton.
I mean, you say that you're changing people's lives.
Sure.
Like with 6-month smiles, right? Mm-hmm. This fast orthodontics for adults. Changing people's lives? Is that an overstatement?
Let me, if you had, people think we're in the, once we had a staff meeting with doctors who work for us, I went on and said, what business are we in? Oh, we're in the teeth business. I said, no. We're not in the teeth business. We're in the people business. It just happens to be teeth are attached to the people. And if you think about it, you know, we think of dentists, you fix teeth. But really, we're in the people business. We're in the self-image business. Many times, people's self-image, self-esteem, egos are affected by their inability to smile. I mean, we can change an external thing and change something internal. Change the way people think, feel, and act. And I'm a big believer in the way you think, feel, and act, how that affects the way you live your life, basically. And I've said people, you know, story after story, they come in like this, they don't want to smile. Men grow mustaches long.
Like the walrus mustache.
The walrus, and then they shave their mustache. Men don't show emotion to women. I mean, I say many times that I've gotten more hugs and kisses by people who've spent tons of money on their teeth than people we've done 1 crown on, because you've changed the way they feel about themselves, the way they look. Your external changes the internal, and the internal drives your external. I mean, it goes together.
Okay, so this 6-month orthodontics.
Correct.
You swear by it. You love it.
It's short term. I mean, I've done cases that I'm even surprised they work. So
who's a candidate? I mean, what are the categories of these 6-month smile patients?
It's not for children. It's anywhere from 18 to 90.
Do you call it adult orthodontics? I mean, it could be called
basically adult short-term orthodontics.
Okay.
And it's for people who maybe had braces as a child and their teeth have shifted, or they have spaces, they don't like the spaces anymore, or the spaces got worse. Sometimes they don't have, now the spaces are changing because they've gotten older, or they're just crooked teeth. And you know, a lot of times people just show their bottom teeth. They don't show, as you get older, you tend to not show your top teeth.
Good point.
I've had people who only come for the bottom front teeth. And
how easy is that for you, by the way?
Easy.
I mean, that's,
well, I mean,
it may be technically demanding, but as far as the patient's concerned, it's pretty straightforward. I mean, you're able to straighten those teeth.
I mean, in 6 months, they have straight teeth. And
anybody faster than 6 months?
Not that I know of.
Okay.
No,
okay.
In fact, I just did a lady in 3 months. You're not done in 6 months. You're done when the patient says, I like it.
Okay.
I had a patient came in 3 months. She says, I like it. I said, you want to keep going? She says, no, I like it. We took them off. I've had people.
Are they clear? Do they look like traditional braces?
Good question. When kids have braces, you know, you get the metal tinsel look. There is something on your tooth. It's a tooth-colored wire and a clear bracket. So you physically wear something. It's cosmetic, but not invisible, unlike Invisalign. You know, there's another short-term orthodontic procedure called Invisalign. And Invisalign is probably more cosmetic because you don't see anything. They're removable trays. The disadvantage of the Invisalign, and we do Invisalign in our office, so I'm not disking Invisalign. It's a great procedure. It takes longer. It tends to cost more. And it has limitations. You can't rotate teeth as well, and there's certain things you just can't do.
I had an orthodontist on the show say, Randy, the problem with Invisalign, looks good at the drawing board, but good luck compliance. People eating five times a day.
That's the very last thing I was going to say.
Is that true? So it's tough.
Absolutely. I mean, we have people about, I lost my aligner, I can't find my last one. You know,
is that right?
These are on your teeth. You can't lose 6 months smile.
And you can eat with them. You can do whatever.
Eat with them. Yeah. I mean, what people say is, the two main things they say is, I can't believe it was so fast and it didn't hurt. I mean, obviously, adults, believe it or not, kids, you could put bricks in their mouth, they don't complain. Adults, you put something that has a little point, they're going, Doc, this is killing me. How do I get rid? So, I mean, and I have wide ranges of people. Some people, I've done some really crazy, crooked teeth. I call them the next day, how you feeling? Fine. I have other people. It's sore on the inside, and we give them wax, and it takes a period of a few days for the gums and cheeks to get calloused. But once that initial part is over, there's really no pain involved.
And I guess you're supposed to see the dentist every 6 months anyway, right?
Sure. I mean,
so in between visits,
literally, you could have your teeth cleaned, have them put on the next day, and by your next cleaning, you're finished.
Straight teeth.
Straight teeth.
And you say, very interesting here, because you say that you see changes in personality just by giving them a better smile. When you take somebody that didn't like their smile, didn't smile, now they're smiling. How important is the smile in your opinion? And you're a dentist, so obviously you think it's important.
That's a dumb question to ask me. I mean, as a dentist, if you had 3 eyes, you had an eye right on your forehead, and number 10 was turned a little bit.
We're talking about your teeth,
Your teeth. Number 10 is turned a little bit. I'd see that turn number 10, not your third eye. So that's an extreme example. But, you know, if you went to a hairstylist and says, how important is hair?
Okay.
I mean, obviously, it's important. I saw something on Match.com, and I think it said something like, what does a man notice first about a woman? Now, obviously, there could be a lot of things to notice, but the answer was their teeth.
Smile. Yeah.
Their smile, the way they look, their teeth. And I've talked to plastic surgeons. Obviously, when I started doing a lot of veneers, this is an interdisciplinary thing whereby, you know, I've had plastic surgeons say they've fixed people's faces, mostly women, obviously, and when they're done, if their teeth are not good or their hair's not good. I actually worked with hairdressers. We did seminars with hairdressers because this is a combination of things. It's not just your teeth. It's not this and it's not this. If you're this and this, but this looks brown.
Yeah, if you have an old smile.
It's an old smile. And that's the exact word that I use in plastic surgery. If you have an old, it doesn't match up with the rest of you. So you have to, it's a package. And it's not just hair.
But in this economy, why invest in your smile?
Great question. There's no secret that we're in a bad economy. I mean, it's in the news, all you hear about is housing, jobs, and it's getting worse, and then the light says it's getting better. You don't know what to believe. We're in a bad economy. And obviously people are out of work. I have young people out of work, old people out of work. When you go for a job, people look, in fact, one of our local banks will pay for whitening, but only for their salespeople. So they know the value of a smile.
Interesting.
Yeah. And nobody pays for whitening. Insurance is not, this is a cosmetic procedure. But they know, and so if you're out of work, obviously, it's another thing you can do to get a better job. But I'm a firm believer in forget the economy. I mean, I can't change the economy. I can only change my life. I can do what, if I have a need or a want, and I want to get to that, I find a way to get there. And that's what we do for people.
So if you don't like your smile,
right?
Would you say that there's more than 1,000 people within a couple of hours or an hour in your area that don't like their smile? Because I don't hear people complaining about their smile, but is this a big thing?
Well, that's a really good question because people don't come in and say, I hate my smile. They don't. When I do a presentation to people, sometimes I'll say to them, I'll hand them a mirror. I say, did you ever notice that tooth is different shaped or a different position than this one, or that this is whatever I see, and they'll say, I never noticed that before. And then they come back and say, well, what can I do to change that? How do I change that? And obviously then the choice is veneers or short-term orthodontics, or a combination of both. So many times people don't even know that they have an issue. And obviously if you have a big space between your front teeth, it's pretty hard to hide that. But the thing that I find amazing is people don't know what's available. And that's, I think, the purpose of the show.
Is that right?
I have people who have been in my practice for 30 years, 34 years. If I don't tell them I do this, how are they going to know? If I don't, can I tell another LVI story?
Let's hear it.
You've had
LVI. We're talking about this Las Vegas Institute where you learned dentistry.
You've had the founder of LVI on this show. I've seen him on the show. He tells the story when he started his practice in Las Vegas. He was a cosmetic dentist. He had a patient come in for a cleaning, and she had all veneers on her teeth, and she didn't have one 6 months before that. And he said to her, "Can I ask you, who did your veneers?" And she said, "Who did it?" And she said to him, and he said to her, "Well, why didn't you let me do it?" And the obvious answer was, "I didn't know you did it."
Interesting.
I didn't know you did it. And part of what I'm here today is tell people we do it. Where people don't know this is available. People only think that you can get, they don't want to do 2 years of braces.
How is this different or better than traditional orthodontics, by the way?
Traditional orthodontics is generally a 2 to 3 year procedure. With traditional orthodontics, it's comprehensive. You're changing the bite, you're changing everything, and you're getting straight teeth. And it's generally good, and it's perfect.
So they're moving all the teeth?
They're moving all the teeth, changing the bite, whether it's adult or children.
Okay.
You come to me, you're an adult, you have a crazy bite in the back, a cross bite or an open bite, whatever thing. The 6 month smiles, the adult cosmetic orthodontics, is meant to change the teeth that show, the 6 or 8 or 10 front teeth.
Interesting. Okay.
And it's not meant to change the bite around, and that's
so it's
the
more
beauty.
of a cosmetic procedure.
And it also, it sets you up for, if people get done that and they say, you know what, I don't like the color of my teeth, I don't like the shape of them, but they're straight, and then they may do something else in connection with that. But it frames it for getting ready to do the next part, if there is a next part.
What are the age ranges of people that would qualify for 6 month braces? How old can you be to do this?
Can you breathe?
I mean, what's your oldest patient, let's just say, even for cosmetic dentistry?
80s.
Really?
Yeah, I had a lady.
Interesting.
I had a lady come in, been a patient for years, and had not really attractive teeth, functional teeth, functional.
Means she could eat and chew.
She could eat. They looked like 80-year-old teeth. Okay. And she had a partial with a clip, and she says to me one day, "I want to get new teeth." And I said, "Catherine, I can do it, but it's going to cost," I gave her the number. And she says, "I don't care. I want new teeth." And we did new teeth. And she has a beautiful smile.
And she loves it.
She loves it. So age, there was a question with age.
But to move teeth orthodontically with these 6 month braces, is it healthy to do this to a 75-year-old, which is young today?
As long as you have dental health, you can move teeth. If you can be 30 years old and have bad gums, you're not moving teeth. This is still, there's parameters you work with.
So if you have bad gums, you just can't do it?
No, I send them to a person who treats gums. Okay. And they get their gums fixed. Then they come back. As long as we get the blessing from the periodontist, who's the expert, then we can do whatever we want to. If they come back and say gums aren't good, aren't going to be good, well, I'm not going to start moving teeth around. It wouldn't be healthy.
Now, you've been doing dentistry how many years? About how many years?
1976.
Okay, 1976.
So that's 30.
Because you told me on the phone that, I mean, you like this now. This is kind of giving you, this 6 month smiles has I don't know the words you said, was like rejuvenated you or done something to you.
You know, you do something for so long. That cosmetic revolution was that light, that fire that got me up again. You know, this is not just drill and fill. This is making people different. Asking, they want this done. They want to look good. They're kissing you, hugging you. Men hug me. And that, you know, men don't hug. Men are very unemotional. Men don't show the emotion.
Just because of their teeth. Good.
I hand a man a mirror. I hand a woman a mirror after we do her teeth, and they cry. And I hand a man a mirror, he goes, that's good. And then they get some hugs, but they appreciate, it's a different show of emotion because they're obviously.
Did they ever say, I should have done this years ago with the 6-month braces?
Once again, it wasn't available when I wasn't doing it. Even my own patients. Why didn't we do this before?
So you're doing things now you couldn't do.
And your original question was, how did this, why did I get excited by this? Because, you do something for 36 years, the same thing, it can get monotonous. Obviously, the joy of doing the dentistry isn't just fixing it, it's the relationships I build, it's the people I know over the years. That's all part of it. But I'm still just crowning a tooth. When the veneers came, it changed people. So now I was getting, I don't want to say bored, but that became routine. Like general dentistry became, the cosmetic dentistry started to become routine. And I guess the thing that really is, obviously when you start something, you never did it, you're not sure it's going to work. So you do it on somebody you know. So we did the first one on an employee, obviously. So when we
brought photos, show me some of this. So,
actually, this is Lynn. Lynn is my dental hygienist.
Okay.
Does not have
pretty nice smile.
A horrible smile. She has.
What's wrong with that? As far as her, what didn't she like?
She didn't like this tooth stuck out, and she had
on the right side of the mouth.
On her left side.
Her left
right
side
in the picture, but her left side. It stuck out, and the corridor where the teeth are was sunk in, so you didn't have a broad smile or a wide smile. And that's one of the things we get with 6 months. But the key here was, he was asking about what's the reason people do this. Her daughter was getting married.
Oh, okay.
Now, this is a lady who literally has worked in people's mouths for 30 years.
Now she wants to look good in the picture.
And all of a sudden, she wants straight teeth.
All right.
And she knew I did this
6 month smile
fast because her daughter was getting married in September. This was like April. She says, can we do it? So we did it. And this is what she ended up with. I mean, broader smile, straight tooth.
Very nice.
Big difference.
Okay.
Big difference. And
very nice.
Big difference on a little thing. And as dentists, an average dentist could look at this and say, there's nothing wrong with your smile, go home. But in her mind, there's something with a smile. I've done procedures on people. I tell them, you're not that bad. They go, oh, but I don't like this. And sometimes we get to be the scientist and the dentist, and we wear the hat of being conservative and not listening to what the person's saying to you.
So if they don't like their smile,
they're going to tell you eventually. Okay. Some people do. I was going to say, but my job is to listen and to do the things that'll help them. So that's basically why, people get things done who, I know dentists who would almost say, you're crazy putting braces on that girl. She don't think it's crazy.
One of the people in my office, she has a little space between the teeth. I've never noticed it. She's been aware of it, I guess she says, according to her, for years. The dentist down the street said, don't do anything about it.
Right.
To me, that's a dentist that doesn't care about the patient.
No.
If it bothers the patient, why not?
Don't judge him.
Okay.
It's not, he's concerned about the dental health.
Okay.
I'm concerned about the mental health. That goes along with the dental health. Because as I said earlier, it's the way they feel about themselves. And if they look in the mirror and see that space their whole life, and don't, in fact, I did a couple people who had spaces, who had their spaces closed as kids and it relapsed. In fact,
let's take a look.
Yeah, this is one who.
Here we go.
Big space.
All right.
Actually, this girl, story behind this one, I was just starting to do 6 month smiles, and she actually saw your show on 6 month smiles with another dentist on.
I was interviewing somebody else.
Somebody else.
Okay.
It wasn't near me. So she went online and found 6 month smiles website, found out who did it. She actually lives an hour away. She drove an hour
to see you.
To see me. And I should tell you, when we do this, we have to see you once a month. It's not every week. And so it's not terribly time consuming. You do it. The first visit's long, and maybe the last visit's long. The other ones are just adjustments.
Well, why'd she pick you? She saw you on the website and liked you on the website?
That's a real good question. I think we have a great website.
Okay.
And I don't know what she liked about me. But
okay, so her 6 month smile.
Right.
Let me take a look at that.
That's her after.
Oh, very nice. And for her, what did that mean, closing that gap?
She gave me a hug. I mean, it was, you can't put yourself into that person. You can't put it into the mind. The mind's eye, I think Maslow, the psychologist, talked about, people who have gone through plastic surgery, gone through cosmetic things, and they look in the mirror, and they still don't like what they see. Physically, they're okay, but inside, they're not okay. So there are things inside. So my goal is to make them physically okay, but help them feel good inside too, so they can smile and affect happiness.
Because I guess they've never had a nice smile, so you have to get them smiling again.
Correct. And women do this. They cover their face. They don't talk to them. And they come back and they tell you, now I smile. I had another one on spaces. This only because I think it's good to see, because young girl, college girl, I don't have her, I forgot to print out her full face picture, but that was the spaces bottom and top. And that was, I think that was 5 months.
Very nice. Well, that does make a difference.
Sure. And typically spaces could take longer to close. So we have to be a little...
But if she went to the wrong dentist, I'm calling him the wrong dentist, a dentist that doesn't do 6 months smile, would it have been bonding? Would it have been veneers?
Yes.
Something a lot more expensive.
More expensive.
Maybe 5 times as much?
And once again, not that expense isn't important. Obviously it is. But
this is best for her? This is best for her in her case?
Yeah. I mean, it's less destructive. It's less alteration to the tooth itself.
Okay,
Makes sense? Young girl came in.
That's a pretty smile.
Pretty smile. At a glance, great smile. If you look at it, you know, she was a new patient, found out, I don't even know how that I did 6 months smile. I think she went to the website once again. Most of these people, they just find me for some reason. They find me on the website. 6 months smile.
They hear you talking about this probably.
I don't know how they... But anyway, she comes in and she says, I don't like my pointy teeth.
Okay.
And we could change her pointy teeth. We could shape them or do veneers. And I said, but you know, we can change this. Are you willing to wear braces? And we can change.
And these are clear braces for people just tuning in.
Clear braces, two-colored titanium wire. You know, you would ask me about the difference. With children's braces, it's stainless steel wire. With 6 months smile, that tooth-colored wire is titanium. So if you ever saw titanium, you could, like glasses, they bend and they go back to the shape that they were. Well, this wire has a memory. So it moves the teeth through the spaces. It creates the arch that the teeth have to go into. So,
and it's white colored.
And it's white.
Okay.
So she came in and now she has not a good smile, she has a great smile.
That's very nice. She looks like a young, like a kid in the before and the after, just very nice.
It's more like a lady.
Yeah.
But probably my crown jewel is my good friend Sonny.
These are like you're showing me baby pictures.
Yeah, I know, my family.
Okay.
Sonny is a 17-year-old boy who came in, and
oh my goodness,
he was a train wreck. That's a train wreck. 17 years old, obviously girls are important, appearance is important, the way he looks, feels about himself is affected. You know, if you had that to deal with every day, I don't care what kind of clothes you wear.
Is that unusual though?
You don't see teeth like that. I see teeth. You know, to a degree, it's a little unusual in the community I'm in. We're in a nice suburban area, so most kids that are 17 have had braces.
Okay.
This kid was not lucky enough to have the ability to have braces as a kid. Was
he really self-conscious about it?
He was so self-conscious. He came in and he said, first I said, how did you feel about, this is Sonny.
Okay.
He said, how do you feel about, what your teeth? He goes, I hate my teeth. He goes, I don't want 2 years of braces. And I went online, and you can do Invisalign or 6 month smiles. And this kid's no dope. He said, I don't think Invisalign's going to work because my teeth are too messed up. And he was right. It won't work. So I said, okay. So I haven't looked at his mouth yet. I look in his mouth and I go, oh my God, I'm not sure I'm even going to be able to do this. I said,
with the 6 month smile.
Yeah. So I said, Sonny, do me a favor. Go to an orthodontist and get an opinion before we do this. And he said, I'm not going to do that. I want this done fast.
Okay.
His mother was there, and they had a discussion, and we got...
So you roll up your sleeves?
Roll up my sleeves. We actually had to take a tooth out in the front, which happens when it's real crowded, and that's his finish.
Oh my God, very nice.
Almost...
In just 6 months?
That was 6 months to the day. In fact, they came off this week.
Very nice.
Almost unbelievable.
And what does he say?
Sonny's is a quiet, but when he comes in, he goes, I like it. I like it.
But he's a lot of people. I mean, there's a lot of people out there that don't know what their options are.
That's and that's, I say, the purpose of me being here is to tell people that there are things available.
I mean, you told me even though there, you want to see, I mean, you want to get the word out. I mean, that's one of the reasons why you flew out here to San Diego to be on my show,
right,
to get the word out. Final message, somebody watching this, they have crooked teeth. Maybe they have the money, whatever, but they're, you know, their fear of the dentist is keeping them from doing it. Maybe their fear of the cost, or they just, for whatever reason, what do you tell them?
Well, you know, if you have crooked teeth, or you don't like your teeth or your smile, go to your dentist and find out what's available.
Okay.
Because many times it could be something as simple as recontouring, bonding, or even whitening. Or it may be more involved where you need to do veneers and or short-term orthodontics like Invisalign or like 6-month smiles. Because if you have a need and you want something, find a way to do it. Don't just sit there and say, oh, this is out there and it can be done.
A lot of people are miserable, you said to me over there, for many years before they do something, right? A lot of wasted years being miserable about your smile when you could go, and this is affordable. Like you say, it's not about the money, but it is affordable. It's a lot less than veneers, a lot less than some of these other procedures.
It's less than traditional orthodontics.
It's even less than Invisalign? We're about to say.
Yeah, less.
Interesting.
Less.
Interesting. Well, I want to thank you for coming on the show. So if they want to learn more, they could go to your website. They could even order your book. Is your book on the website?
My book's online on Amazon. You can get it on my website too. Actually, the website, I have, just Google Joe Capista and there's a...
What can a dentist teach you about business, life, and success?
Correct.
It was a motivational book. I listened to about an hour of your podcast. And I told you when I saw you, I said, I am pumped up. It's inspiration about life. It's more than just a smile. So I want to thank you for coming on the show.
I appreciate it. It's great to be here.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com. And if you want to see this again, you only caught part of it, you can type in Dr. Capista or 6-month smiles and you'll find them there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.